The frustration barrels through the bullhorn. These community health workers are weary after months on the front lines, underpaid and underappreciated. COVID hit hard and we were working triple time helping patients, she says, with no extra pay, left vulnerable. Suman Balhara caught the virus at work in India's first wave and is still suffering, struggling to breathe. With a family to help support, she has no choice but to work through the pain. I have to live with it, she says. I take painkillers to make it through every workday. Neelam Jaiswal is also living with the after effects of a severe case of COVID-19. She's home from hospital now, but spends most days in bed hooked up to oxygen. I'm feeling better, she says, but still weak and anxious. The emotional toll is hitting her husband, too. He can't bear to think of where they were a few months ago, the scramble to find a hospital bed and oxygen for his wife.
I was crying at home alone. When I was alone, I cry. What to do, how I can save her.
These days, the worry is over her recovery, getting his wife the right pills, booking her hospital tests as the medical bills pile up. You don't have insurance?
No, I don't have any insurance at that time. Totally cost more than 25 lakh.
Pushing $50,000 and counting.
Still going on. Medicines are going on, tests are going on right now.
The sheer scale of India's second wave of the pandemic means many are in a similar position. Malini Prasad checks her oxygen levels over and over. She's adjusting to life confined to her home, trying to get her energy levels up.
I ended up spending 90 days in the ICU, which is like one of the longest tenure one could undergo.
It's a dramatic shift from a healthy young mother in her early 40s to a woman fighting to get back to normal, unable to work. The scars of India's brutal second wave are also still fresh at this New Delhi hospital. In April, this ICU was overflowing with patients packed in everywhere, all gasping for breath.
Another couple of hours. So we are struggling.
Dr. Sumit Ray, head of critical care, was constantly on his phone, begging for more oxygen that was fast running out.
We were working non-stop, and in spite of that, there was not enough time.
And it was for a sustained period of time.
50 days, I keep telling, 50 days of hell, absolute hell.
Today, there are only 2 COVID-19 patients, down from a high of 400. The hospital, like many others, has a new stash of extra ventilators. It's massively increased its supply of oxygen and is getting a new liquid oxygen generating plant to avoid a shortage next time, mirroring the Indian government's push to double the country's production of medical oxygen ahead of a third wave looming this fall.
So I'm hopeful that it won't be as bad, the third phase, but we have to always be alert to the fact that it possibly can.
Alert and prepared, bracing for whatever may come with the next wave. Salima Shivji, CBC News, Delhi.